My name's Jason Lesch. I'm the CFO at Auburn Community Hospital. I've been here for about 3 years. We're a $125 million hospital, 99 beds, sole community provider. We see, in terms of patient registrations, 250,000 registrations a year. On the inpatient side, we have about 5,000 admissions. The ROI on EZDI has been over 1,000%. Within 2 months, it has paid for itself. It also has improved the coder productivity by 100% compared to other studies, and it has reduced our did not final build by 3 or 4 days. And the CMI has gone up. The result on the CMI in relation to the ROI has been an additional $1 million, about a 4.5% increase in case mix. The benefits EZDI has provided to us are coder productivity, increased case mix, and then future opportunity to utilize the expertise that EZDI brings. And you as a small hospital, you don't know what you're missing until you start implementing a program like this and working with a vendor like EZDI. So I see the biggest benefit is ongoing opportunity to work with you and further develop your product and solve problems that we have. We didn't know the problems that we had going into this or the efficiencies that we could bring to this. And the result, the ROI on it has been tremendous in terms of 5% return in terms of increasing revenue. And the coder productivity has gone through the roof, considering ICD-10 has come down the pipe. So not only are our coders happy, financially we're happy, our IT staff is happy, and there's been no disruption to any of our existing processes. So EZDI was built totally outside of any of our existing processes or workflow. So it didn't disrupt how we were doing things. And if we ever had to, we could go back to what we were doing. There's no need to do that, but we could. So it's a totally independent standalone system that is taking the data that we already have and then utilizing that within their program. So there really is there's no risk. If we had to, we could set up and go back to what we were doing. We'll never do that. But it's a nice way to do things. It's not like you're setting up a new EMR and it's disrupting your billing system, your coding workflow, all of that. There was no disruptions. As soon as we started using the program, our coders were just as efficient as they were before, day one, and then they became more and more efficient as they used it over the first month or two. As a message to the other CFOs when they're taking a look at what should I choose, EZDI, there's no downside from, number one, there's no downside from using them. It's all built outside the system, and it works. As far as sometimes it's easier as a CFO, let me go with the big name because then I'm safe. But it might cost you a lot more if they can't implement it. EZDI, with the track record with us, they did it. And not only are they doing it, they're working with us on solving future problems, current problems, and really as we get into population health and being able to not only get the data, but know what the data means. That's what they're building. I don't know if these other companies are building that. Sometimes it's safe, but it costs you a lot of more money to go with those companies. And are they going to provide that personal touch to understand your business? So those are questions as a CFO you have to really ask yourself. And sometimes they allocate only so much money for this. And what I've seen with some of as most CFOs have, when I was a consultant, when you get to the end, sometimes you don't maximize or get what you paid for. Your billing system is the last thing that gets focused on when you've implemented a new EMR. Well, you can't afford to do that. You need to finish the task and do it according to what the budget was. And they've done that. And I would definitely recommend that you work with EZDI utilize them, and you're going to reap the same rewards that we ended up reaping. And we like to look at upstart companies because sometimes the old guard isn't as technologically savvy as the upstarts as a small hospital.